Dr. Mike here. Finally, there's mainstream recognition on the role of inflammation and heart disease. This is good news. Stick around to learn more.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
I want to say, welcome to Live Foreverish.
Yes.
Thanks
for listening.
I want to say Life Extension, who's our sponsor, probably was one of the first companies to publish a magazine article on chronic inflammation back in the 80s. I'm not going to say we were the first, but they were one of the first.
I think trailblazers.
Trailblazers, definitely a big thing. All I know is, Life Extension, myself, you, other integrative physicians, we've been calling chronic inflammation that a huge missing link for conventional approaches to prevention and treating disease.
And what's shocking to me, Dr. Mike, is I recall reading a paper, New England Journal of Medicine paper that outlined how plaque formed. This is years ago.
Yeah.
And inflammation was all over. You see the white blood cells and the macrophages coming in and becoming foam cells. And you see that it's a part of the process. And it takes time.
It takes
sometimes
time
for that message to
translate to something
that you'll find in your primary care.
Yeah, and so what we're talking about is the American College of Cardiology has finally recognized this. They're finally recognizing inflammation as a role in disease in the risk of disease for heart disease. If you have it in the progression of that disease, it's recognized inflammation as being something we can look at to target prevention, primary prevention, secondary prevention. And one of the key markers that they finally have agreed to start looking at is CRP.
I think that's great. And I'm excited about it. The paper is free if you want to find it. It's again, American College of Cardiology, their scientific statement on inflammation and cardiovascular disease. But they look at, first of all, it's not acute inflammation. We're talking about chronic, low grade inflammation that you don't always feel.
Most cases you probably don't.
But
right?
It's there.
But it's there. It's smoldering. It's like that fire that kind of got put out, but you can still see some smoke, a little ember deep in there.
I love that you say that, because there's something later on where they talk about putting out the inflammation or the inflammatory process, and that process, the inflammation resolving, and those byproducts of omega-3s that help to resolve the inflammation. And so we're not having that. So they talk about the low grade inflammation, primary, secondary prevention, inflammatory pathways, and they even give behavioral and lifestyle risks. So that's kind of our outline.
Yeah, let's kind of dive into this a little bit, right? Yeah, let's dive into this. The first thing is, we're talking about what's known as high sensitive C-reactive protein. And now they're recommending this for screening for primary prevention, including obtaining a single measure of high sensitivity CRP, and they're looking for anything over 3 milligrams per liter.
And that's a single measurement.
And that's a single. If you're over if you're not going through an acute injury, an acute illness, and you get your high sensitive CRP back, if it's greater than 3, that's risk.
And so the step 1, which is, I love this, elevated CRP greater than 3 should be treated with lifestyle interventions. So this is, hey, we need you to eat more fatty fish. We need you to eat more fruits and vegetables. We need you to move.
Move more.
Right.
Yeah, get out there and get moving, active.
Like, let's look at
All of that.
how we can get
lose some weight. If you
inflammation
need to lose
down.
some weight, I mean,
Right.
it's all part of that.
Talk about stress, talk about sleep, you know,
If you
the
smoke,
lifestyle.
stop smoking. That's a
Yes.
big one.
Right.
Yeah. All that stuff.
So that's phase one. But then they go on to say that if it's persistently elevated, then you should start
Yeah, I know.
or
This is gonna
increase the statin regardless of LDL numbers.
I know. And now this is going to cause some people to, she wrote wow in the script. Wow. People might call us, get some emails. That's fine. We can explain it. It is important to note that in the early research of statins, and I do know this, remember I was part of the AstraZeneca team that brought Crestor to the market. And, even way back then, there was a recognition of some anti-inflammatory mechanism of action in statins. And that has been researched by several statin companies. And it does show. Yeah, I mean, there's evidence that statins can reduce inflammation. And they've been wanting that indication.
Right.
For a long time. And now, looks like they're going to get it.
Well, I would say don't knock us, the messengers, but I would like to also say is at least they started with lifestyle. And so we're talking about someone that we hope that you've made some lifestyle changes. And then if you find that you're still struggling with those lifestyle changes, then maybe you need to consider adding in that statin, because again, if the CRP is greater than 3, something is going on.
Yeah.
Right. So you need to start trying to modify your risk.
And are there nutrient add-ins that you can go with as well? Of course.
Yeah. We like CoQ10.
We like CoQ10, curcumin,
vitamin D.
You can get some omega. I mean, there's several that have been shown to be anti-inflammatory in research. So that's the good news is there's a lot of options here. As you begin that lifestyle journey to bring down that CRP, hopefully you'll never have to get to that medication, but that's something you could talk about with your doctor if it looks like you need one.
And so I think that to end this section, when we look at screening, is, we didn't talk about the secondary, but I do want to just say there's a quote from the study, and it says, because clinicians will not treat what they do not measure, universal screening of CRP in both primary and secondary prevention represents a major clinical opportunity and is therefore recommended. So primary, we can talk about secondary, but basically what we're saying is in your annual lab work, your doctor at this point, according to this, should give you a CRP added to your blood work. And if they're not, ask for it.
There are other inflammatory markers that could be measured as well that I'm sure a lot of our audience knows, that may be wondering, can those be used as well? Interleukin-6, fibrinogen. There's a whole bunch of them, actually. I mean, we have Life Extension has a whole cytokine panel. But it turns out it really looks like it's high sensitive CRP is the way you want to go when looking at primary and secondary prevention.
Yeah.
They also noted, and I thought this was pretty big, that high sensitive CRP is at least as powerful. Now, this is for secondary prevention. So this is somebody who's had a heart attack now. And we want to make sure you don't have another one. Right. And we're going to follow your levels. And we want those levels to get down to normal, one. If you remain high, 2, 3, we're worried about that. And what they're saying here is that in those cases, the CRP is at least as powerful a predictor of a recurrent event as LDL. That's the wow. I should have written wow next to that statement, because Dr. Crystal gets excited.
I know so many people, so many family members, and I think you have to, if you're listening to this, you can't assume that your doctor is aware of these current guidelines or the statement, or that they're going to follow it.
No, I wouldn't. No, you need
at all, right? So that's why I'm just trying to say, please take notes. ask for these things. And if you have already had a vascular event, we mentioned greater than 3. Now it's greater than 2. So your threshold is even lower when we're looking at inflammation.
There's other things too they mentioned. I thought the imaging section was kind of I like. Remember, I'm a radiologist. That's my old school stuff, right?
Mm-hmm.
There are MRIs, CAT scans. There's even ultrasound that really by themselves they're not as powerful, but they can be used. If you have somebody, especially with secondary prevention, you're really worried about them. Even to the point where you might want to consider, sending them to the cath lab. But before you do all that, you might look at a CRP with all the other traditional ones like LD and all that, and then do an MRI. So it's, to me, those imaging modalities are going to be, it's not everyday clinical setting. It's in special cases that's going to really help you make a decision.
Yeah.
So, so at this point, hopefully you understand why we're so excited about this.
I think it's a big deal, Dr. Mike.
It's huge.
I think this is going to save lives. And if your CRP is really elevated, maybe then that's telling you a different story, something else you need to check on. So I think it's important that people know this test is available.
So what is the next step then in clinical medicine? So you got this big mainstream institution. They got their ties on and they're up in a high floor in downtown somewhere, and we're going to add CRP. How long do you think that's going to take for that decision in this publication to translate to everyday clinical practice? I'm just throwing that out there. I mean, I'm not, yeah.
I have, it all depends. So this statement, I don't recall this position paper getting breaking news coverage on major syndicated networks.
Nope.
Like I haven't seen it, and you hear all the stuff where there's not a lot of science behind it that is all over the news, all over your headlines.
Here we have good science.
So I am wondering, I don't know, maybe it was picked up and I missed it.
Well, they'll be, they have all their yearly.
This was September. Yeah. And we're October. Yeah. 2025.
They have their yearly, cardiovascular conferences. And I'm sure it's all going to be there in posters.
Well,
and all that
true.
Stuff.
Yeah. I go to the Pri-Med conference and they do every year go over kind of the updates.
It'll get, but there definitely is time to activate. I mean, it takes time, is what I meant to say. It takes time to activate these kind of guidelines and new guideline changes.
Yeah.
So, but here's what you can do, though. If you're listening, you don't have to wait. We always had good information about CRP and inflammation, but now you got a mainstream institution saying, yeah, we need to be checking this. Man, take that to your doctor.
1,000%. I say take it to the doctor, show them it. Again, it's a free paper, show the paper. And then, they also give the behavioral lifestyle risk. And so we kind of went into some of those risks, but they gave specific exercise information, 150 minutes per week.
Dietary information.
Moderate aerobic exercise or 75 minutes of vigorous aerobic exercises.
But here, I'm gonna throw this out there. If you haven't exercised in a long time, get out and walk. Start somewhere. Get in a walking group, whatever you got to do, and just get moving. And as you improve, as your condition improves, you'll do more. You'll start getting to these numbers here.
Yes. Yeah. Yes. And just like a little tip that I can tell you about navigating and having some of this covered by insurance, if you have the elevated CRP, you can have your doctor write a necessity letter, and some of this can be covered. Some of the costs associated with gym memberships, or at least it can be covered by your flex spending accounts and things like that. So
So again,
their strategies.
Yeah, I like that. I like those tips are important for people nowadays, right? So great news. I think overall, it's not just great news because of companies like Life Extension and other institutions, creative institutions have been talking about this for years and years and years.
Mm-hmm.
It's great news because, like you said, it's going to save lives.
Yeah.
Fine. I mean, this is going to save lives, right?
And money. Let's talk about the money it's going to save.
Yeah. You know how much it costs to prevent a heart attack? Not that much. You know how much it costs to take care of it? A lot of money. I mean, you don't even, the math is pretty simple, but it reminds me of all those, even years ago. We used to talk about, how, like the focus on cholesterol, focus on triglycerides and all that. And again, that's good.
Yeah.
But when that was the only focus, all those numbers could be normal and people were still having heart attacks. And a lot of this is coming back to, yes, more detailed understanding of all that, but inflammation.
It's inflammation.
This is fantastic. For more episodes that you may like, we have a huge library over at liveforeverish.com. All we ask is enjoy it, right?
Mm-hmm.
And just let us know what you think.
Yeah.
Comment, give us a like. Give us a review, all that kind of, stuff that you do. And we appreciate that because you're spending time listening and then spending time, maybe responding. But that stuff really does help us. Liveforeverish.com. And then our sponsor, Life Extension at lifeextension.com wants to say thank you and give you a discount of 10% off $50 or more plus free shipping and handling. And you just got to put the discount code in as podcast when you're checking out. I'm Dr. Mike. That's
Dr. Crystal.
Thanks for listening.